In this video, we will focus on the anatomy of the Azygos system. This venous network plays a crucial role in draining blood from the thoracic wall, the back, and parts of the abdomen. It also serves as an important collateral pathway between the superior and inferior venae cavae. Understanding the course, connections, and clinical relevance of the azygos, hemiazygos, and accessory hemiazygos veins is essential for interpreting thoracic imaging and recognizing certain pathological conditions. To do so, we will start with a brief introduction, followed by detailing the descriptive anatomy of the great azygos vein, the hemiazygos vein, and the accessory hemiazygos vein, and finally a conclusion to summarize all the key points. The azygos venous system is a major venous network that ensures drainage of the thoracic wall and serves as an important collateral pathway between the superior and inferior vena cava. It is composed of, on the right, the azygos vein, and on the left, the hemiazygos system, which includes the inferior hemiazygos vein or hemiazygos vein, and the accessory hemiazygos vein or superior hemiazygos vein. This system establishes multiple anastomoses with the caval and portal systems, playing a crucial role in venous return, especially in cases of inferior vena cava obstruction. Let's start with the great azygos vein. The azygos vein arises in the inframediastinal posterior space, from the union of two roots at the level of T11. An external root that is constant, formed by the fusion of the right ascending lumbar vein and the 12th intercostal vein, and an internal root that is inconstant. The azygos vein follows a vertical trajectory in the posterior mediastinum, positioned to the right of the midline. At the level of the second intercostal space, it curves forward, forming the characteristic azygos arch. It enters the thorax and runs along the right lateral surfaces of the vertebral bodies. It then drains into the posterior inferior aspect of the superior vena cava, at the level of the fourth thoracic vertebra. The azygos vein has a length of 20 to 25 centimeters, and a diameter of 4 mm at its origin and 10 mm at its termination. From its origin to its arch, the azygos vein is related to the following elements. On the left, the thoracic duct and the descending aorta. On the right mediastinal pleura. Posteriorly, the thoracic spine and the right intercostal vessels. Anteriorly, the right lung root. On the right lung and right pleura. And on the left, the esophagus and the right vagus nerve. The azygos vein receives several tributaries, including esophageal veins, right bronchial veins, superior phrenic veins, intercostal veins, right superior intercostal veins, and the hemiazygos vein. Let's detail now the descriptive anatomy of the hemiazygos vein. The hemiazygos vein arises in the abdomen as a continuation of the left ascending lumbar vein. It enters the thorax through the left diaphragmatic cruise and ascends along the left side of the thoracic vertebrae. It curves to the right at the level of T7, passing behind the aorta and the thoracic duct to join the azygos vein. The hemiazygos vein receives tributaries, including the four lowest left posterior intercostal veins and esophageal and mediastinal veins. Moving on now to the accessory hemiazygos vein. The accessory hemiazygos vein arises from the left ascending lumbar vein and the left posterior intercostal veins. It descends along the left side of the upper thoracic vertebrae. Then it curves to the right at the level of T7. Finally, it passes behind the aorta and the thoracic duct to drain into the azygos vein. It receives several tributaries, including the first 6 or 7 left posterior intercostal veins and the left bronchial veins. To conclude, the Azygos system is a vital network of veins that ensures venous drainage from the posterior thoracic wall and serves as a key collateral pathway between the superior and inferior venae cavae. Its main components, the azygos, hemiazygos, and accessory hemiazygos veins, follow a distinctive anatomical course and have important clinical implications, particularly in cases of vena cava obstruction or thoracic pathology.